what can I say? So, and I got the call from my good friend Bob Berenson, informing me that I was going to be the recipient of the Bob Ball Award. I was sort of a little blown away. I have had, over the many years, the tremendous respect for the Academy and all that it does. And I have been a big, big believer in Medicare and what it has done and how it has been a central force in our supporting individuals, but more importantly, making our healthcare system the quality institutions that it is with its problems. But also, I work with Bob Ball. Now, I have to admit that Bob Ball and I didn't always agree. So I'm about to tell you an almost true story. You know, it's been 45 years, so occasionally I might miss a few facts here and there. But you know, for academics, it's close enough. So here's the story. In 1971, at a very young and tender age, I became a pretty high-level official in what was then the Department of Health, Education, and Welfare. In that department was both Social Security and Medicare. Now, how a good Bronx boy who sent out letters for the Socialist Party in the Bronx wound up in the Nixon administration, I do not have enough liquor to explain. But if you give me a few extra, I will explain it. So there I was in 1971 as the Deputy Assistant Secretary for Health Policy. Soon after I got into HEW, the good conservative Republican President Richard Nixon imposed wage and price controls. Anybody remember in this audience wage and price controls? I think the only person that didn't know he did it on a Sunday was me. My 7-year-old had scored her first goal, and I was a happy father. So I came into my office on an August morning, happy camper, and my secretary was as white as a ghost. The White House wants to see you. Now, you have to understand, this was the era of Haldeman and Ehrlichman. People went to the White House and were never seen again. This was not something that a 35-year-old with 3 little kids wanted to hear. So both of us went under my desk, and she said, you got to go to the White House. All right, I went to the White House, and there was sitting around all the president's men. I'm sorry, there were no women in that group. And the chairman of the Council of Economic Advisors, Herb Stein, looked at me and he said, Dr. Rahman, do you know how much money we're spending on health care? Well, truth of the matter is, I really didn't know. But I suspected. Well, but before I had a chance, he said, we are spending $75 billion. It amounts to 8.5% of GDP. And if we reach 8%, our whole way of life is going to deteriorate. For those of you who haven't been keeping score, it is now 3.2 trillion, 18% of GDP. And he said, you're going to be in charge of controlling healthcare costs. The President of the United States wants to be control health. I'm 32 years old. I don't give a damn about the healthcare system. I'm going to control healthcare costs. I'm going to do it. I can do that. I'm an economist, second to surgeons. We're the most arrogant people you ever met. So we begin to control. Now, remember, this is a Republican administration, so we're going to control the most powerful industry in America, but the Republicans wouldn't put anybody in charge. So we said, well, you know, we're going to control, we're going to have wage and price controls and stuff like that. We have to sort of find out what's going on. So we said, we have to have somebody to evaluate it. They said, we know the perfect group to evaluate this. We're going to have the Internal Revenue Service evaluated. The doctors are really afraid of the IRS. I said, that's a wonderful idea. So we begin to regulate healthcare costs, and I'm in charge. After about 8 months, I get a call from the Internal Revenue Service, and they come to see me. And these guys with necks the size of me come in and they say, do you know how complicated the American healthcare system? We haven't got a clue what they're doing. We're not going to do it. I said, the President of the United States wants you to do it. We said, we don't give a flying. We're not doing it. It would take every IRS agent in America to do it, and we still wouldn't know what they're doing. We're not going to do it. So I said, you have to do it. This went on for 20 minutes. Finally, I knew I was in a lot of trouble. So I finally said to them, would you please not tell anybody? Don't tell the doctors. Don't tell the hospitals. They will think the IRS is controlling their healthcare costs. So then, okay, so that puts, and then I get now remember, I get a bright idea. I said, there's this Medicare program. And after all, the Medicare program is a government program. Why don't we use the Medicare program to really regulate the American healthcare system and put pressure on them, because we have no idea what the private sector is going to do. I thought that was a brilliant idea. All of a sudden, I get a call from Bob Ball. I'd like to see you. Now, for those of you who know Bob Ball, seeing Bob Ball, now, it wasn't clear who was in charge of who, but this was a very respected senior person who had created the Social Security, been involved, created Medicare. He and Art Hess. Even I was intimidated, which took a lot. So I went to see Bob Ball, and here's the story. He looked at me, and he pulled down his glasses, and he said, I don't like this idea. I said, well, what idea don't you like? And he said, you are going to make the Medicare program as a regulatory arm of the healthcare system. I said, well, what's wrong with that? He said, look, we made a commitment to the American people that every one of them would have access to complete health care, all the hospitals, all the doctors, and that we would be a decent payer of health care. As a matter of fact, we had created the private Blue Cross insurance mechanism for paying cost-based reimbursement so that this government program would be a decent payer. And you are going to separate the Medicare program from the private market. If you do that, over time, what will be created will be a differential between Medicare and private insurance, which over time will lead to Medicare beneficiaries not getting access to the best that America has to provide, both in terms of hospitals and doctors. Now, at that point, I didn't appreciate what he was talking about. And I sort of won the argument and convinced the secretary that we needed to have the Medicare program be the regulatory arm. And I'm here to tell you that was a gigantic mistake. Bob Ball was absolutely right, as he was on so many other things. Nancy, you got it so right. So, I hate to this has been a wonderful experience. I've really loved being here. This is a wonderful opportunity, but I need to do a little policy analysis. I'm sorry. So if you'll put up this one slide that I have. I'm here to tell you Social Security and Medicare are not the same. They are fundamentally different programs. In Social Security, Walmart and Safeway and every other doesn't worry about what Social Security does. Social Security is a wonderful program. I couldn't agree more with you, Nancy. And by the way, I am convinced in the shtetl in Poland, the two of us were related. But Social Security and Medicare are fundamentally different programs. Social Security is really a fundamental, and I strongly believe it, but Medicare is really at the heart of the American healthcare system, and it separates them in fundamental ways, and I have spent my life trying to make them both work. Well, I'm here to explain to you what is going on in America today. This is not an ideological. I know many of you believe Medicare for all is the right model. And I understand that and can be somewhat supportive of, but I must admit, I'm an affordable care guy. I believe the Affordable Care Program is exactly the right balance, but both of us, both groups want the same thing, which is guaranteed, universal, decent coverage for all Americans. And I beg you, as groups, we need to work together. There is another set of forces out there that want to do evil to both of us. And I ask you, Bill, the Academy has to bring us together. This battle between Medicare for All and the Affordable Care Act is going to destroy us both. So here is this. We need to work together. This is not something that we can afford. So here's the story that I'm about to tell you. For those of you who don't spend as much time about the American healthcare system as I do, look at this chart. Beginning in the mid-1990s, we have seen a violation of the Bob-Ball principle, which is growing by leaps and bounds. Currently, between that the private sector and Medicare are going in opposite directions. The gap between what private pays and what public pays is approaching 70%, and in many parts of the country, it is over 100%, which means the same kind of patients. Now, the private and public are paying privately twice as much as Medicare. This is not healthy. This is not good for Medicare. Now, this is exactly what Bob Ball argued against, and he was absolutely right. We cannot see Medicare and the private insurance market move in opposite directions. If we do and continue to see that, you will see Medicare beneficiaries becoming denied access to care. Fortunately, currently, I know of hospitals are denying Medicare people. And I'm a Medicare recipient. I've had wonderful care from Medicare, although I wish they'd send me balloons when I got operated on. But that's another question. The point here is that this gap is getting wide, and it is not. Now, if you flip from hospital side to physicians, we're already seeing the canary in the coal mine. More and more primary care physicians are now going to concierge medicine, which I believe is immoral, unethical, fattening, and I must admit I joined it because I've lost 3 primary care physicians in the last 4 years. And if I went around the room, you will find several of you who are already having, because they feel that Medicare is no longer paying them an adequate rate. Now, I'm not here to argue whether Medicare is the right number or not, and I'm not here to argue whether Medicare should raise the rate. What I am saying is that this is a dangerous for Medicare and for the rights of others. We have to work to figure it out. Maryland and Massachusetts are trying to make a difference, and I would encourage you to look at what we're doing in Massachusetts and Maryland to try to make sure that this gap does not get wider. But the important thing that I want to bring back how wise Bob Ball was, it is a bad public policy for these 2 important programs to become so widely different. And as I said, over the years, I really began to appreciate how smart he was and how stupid I was. And I hope I've learned a little bit. So, in closing, you know, Bob Ball was an incredible human being. He represented the best of civil servant, as you pointed out. I wish I was smart enough at 32 to appreciate that. But I employ all of us. We need to work together. It is so important that the American people get a comprehensive, decent healthcare system. Medicare for All has a lot of advantages. I'm not arguing against it, but it has some big disadvantages, particularly in terms of this. So we need to work together, and it's your responsibility to bring us together, Bill, and make this academy, make us both work together so that we can find the right solution. What a pleasure it is to have the Bob Ball Award. I want to thank you, Bill, for giving me this opportunity. I want to thank, Chris for, bringing, Bill Clinton on the scene, and Karen and Chip, I mean, the idea that Chip fired me is, I haven't recovered yet, but it's all right. So thank you all very much. This has been a wonderful opportunity.